Now, Deputy President Paul will hope to build public awareness today about the global epidemic of tuberculosis and efforts to eliminate the disease. He's expected to deliver the keynote address at the World TB Day commemorative event in Evaton this morning. Newzroom Afrika's Katleho Sekhotho joins me now live from there ahead of this address. Katleho, very good morning to you. Today, of course, highlighting some of the loopholes insofar as tackling and curbing the rate of tuberculosis in South Africa. What can be expected at that event today?
A very good morning, Poi. Indeed, according to the World Health Organization, in the year 2022, over 54,000 people died from TB, while about 280,000 people fell ill. But despite those numbers, it appears that South Africa is doing incredibly well in reducing the numbers, and with the goal of eradicating TB as an epidemic by the year 2030. So today we will be hearing from the Deputy President, and he'll be speaking in his capacity as the chair of SANEC to outline the interventions that have been, outlined so far and implemented so far in really reducing the numbers of TB across the country. But I do have with me Professor Ndjeka, who is the head of TB, National TB Program, just to give us more details about today's events, but also the numbers as it relates to TB in South Africa. Professor, thank you for your time. Just take us through the stats in South Africa. Are we doing well in reducing those numbers?
Yeah, thank you so much for inviting me. Really, we're excited that despite the challenges, we're doing well in terms of reducing numbers for tuberculosis. Some years ago, I remember when I joined the TB program in 2009, 1% of the population of South Africa would develop active tuberculosis every year. That was 500,000 people. And you just said now, we dropped that to 280,000 a year. That's a big decrease. It is a big change. It has dropped, yet it's work in progress. So a lot has been done to reduce the numbers.
And now one can say, looking at the fact that there is treatment for TB, why do we still have these fatalities, these death rates? What is the challenge in really just eradicating it completely?
Yeah, thank you so much. That's a very important question. Despite improvement, we still have two major challenges. A big proportion of our people do not finish treatment. In fact, they drop along treatment. So that's a big problem. That leads to higher mortality. But there are also other factors that lead to people dying. But the main one is that people don't finish treatment. And that is really a problem, it's a tragedy. We've not given the necessary attention that this deserves. But also, our numbers in terms of TB deaths came down significantly a few years after introduction of antiretroviral therapy. But after experiencing that sharp decrease, we didn't see the decrease going further, which tells me that we're not done very well in supporting our people. Social support, nutritional support, actually psychosocial support and nutrition, we're not done very, very well. A lot of our patients have a very low body mass index and they die. So I think those are some of the things that we need to be paying attention to moving forward and working with social development.
Yes, and indeed, Professor, throughout the years we understood that TB treatment was at first 6 months, it could take 6 months, and then it dropped down to 4 months. What are the facts in terms of how long treatment takes?
So in terms of treatment, we do have drug-susceptible TB, which we call ordinary TB, and we've been treating people for 6 months. But there's also what we call multi-drug resistant tuberculosis. We used to treat people for 2 years, then it dropped to 18 months, 9 months. Recently, we started to treat our MDR-TB with a 6 months treatment. Regarding the drug-susceptible tuberculosis, we're making plans to decrease that from 6 months to 4 months, but we've not yet started with that. So most of our TB now get 6 months, whether drug-susceptible TB or MDR TB. They all get 6 months treatment, which is exciting for the MDR TB, because you'll agree with me, it's very hard to keep someone on treatment for 2 years. It's too long and a lot will drop. So we're hoping that fewer people will be lost to follow up with 6 month treatment for MDR TB.
And I guess just the last one, Professor, in terms of the taboo or the social conditioning around TB and the way people view it, are there still challenges there in terms of, taboo ideas, people resisting that they have been diagnosed with TB, or is there a larger acceptance now?
Yes, so stigma is a big problem that leads to comorbidity, we see, and all the problems, the mobility, the poor outcomes. And so what we're doing from the National Department of Health is to improve our communication. We have a strategy to address behavioral change communication. And we're hoping that with that we'll see much improvement moving forward, because stigma is really a big problem. But we must also make effort to measure it. I don't think we've measured it well in the past.
Thank you very much for your time, Professor.
Thank you.
Thank you. Paul, you heard it there from the Professor, head of the National TB Program, just outlining that there still is a stigma around TB in the country and that they are dealing with challenges like that. But overall, South Africa doing well in reducing the fatalities linked to TB, but also just encouraging people and, hammering on that message that people really need to finish their treatment, and this will drastically reduce the number of fatalities as it relates to TB.
And when is the program set to get underway, Katleho?
The program is set to get underway in about half an hour, Paul, and definitely that keynote address by the Deputy President Paul Mashatile, one to look out for in terms of the interventions being made and implemented, as well as the key findings perhaps over the last year.